Good evening, everyone. Thanks for joining us. If you're on the telephone now, this is County Executive Mark Molinaro. You're joining a live telephone and Facebook town hall meeting. We're calling, every phone number in Dutchess County, so it's going to take a little time. As we call out to thousands of your neighbors, we just ask you to be patient as we make some connections. But you're joining us again for another Facebook Live and telephone town hall meeting. This is County Executive Mark Molinaro. We're going to talk a little bit tonight about the data points, so where we are with COVID-19 and our response. But specifically tonight, we want to get to questions and address concerns regarding vaccine distribution and the medicine and science behind the vaccine. And so we're joined this evening by Dr. Anil Waithian. Dr. Waithian, of course, is Dutchess County's Commissioner of Health, Department of Behavioral and Community Health. Anil is an infectious disease doctor and has been leading our team in response to this pandemic these last nearly 12 months now. We're also joined this evening by Dr. Michael Guitz. Dr. Guitz is the physician-in-chief at Maria Ferrari Children's Hospital at Westchester Medical Center, and he's here tonight also to assist us in talking a little bit about the vaccine. I'm going to preface that by telling you that we're going to be on live for 90 minutes, so we'll be here till 7 o'clock tonight. So we're going to try to get to as many questions as possible. Again, this is County Executive Mark Molinaro. If you're calling in, so those of you watching live on Facebook, I've got to remind folks as we're making phone calls, they don't get to see me, and that's probably to their benefit. But nevertheless, we'll give those residents calling in and on the telephone line some time to get on the call. If you're on the phone tonight and you want to ask a question, please dial 0. So press 0 on your phone. You'll be brought to a recording. Record your question, and then you'll be, when we get to your question, you'll actually be live to ask your question. I would just ask when it comes time to ask that question, if you could stick to specifically, the question. We'd like to get to as many as possible. We're not screening any. We're just kind of recording, and then we'll organize getting you in the queue. So first tonight, I do want to acknowledge our American Sign Language interpreters. They have been with us for 12 months now. I'm told that I speak very fast, which means that these telephone town halls are kind of like going to the gym for them. This is their night out, and we appreciate that. But they've been great to be with us, and of course, we know how valuable their work is and how important it's been to communicate with all of our residents. And I do want to just acknowledge again, it's County Executive Mark Molinaro. We're calling thousands of your neighbors across Dutchess County for our Facebook Live and telephone town hall. If you have a question, dial 0. We'll get to as many as we can tonight. Let's jump, however, to a few data points just so we can talk through where we are. So it's been obviously a long 12 months, and a lot of individuals, families, businesses have suffered a great deal of loss. Now, the good news is these last several weeks, we've seen a bit of a decline in positivity rate. So let's talk a little bit about where we are. Having conducted having seen 18,235 active COVID-19 cases in Dutchess County these last 12 months, we are now at 1,707 active cases, 1,707 active cases that the health department's been monitoring. We're at, we're at 162 hospitalizations. Now, the positive news is that is a slight decline over the last week. However, our hospitals are still seeing regular admissions, and I would tell you that the cases that are coming to the hospital, again, broad demographic, but principally the more severe cases are among older Dutchess County residents. Now, the month of January has been the deadliest of the 12 months we've responded to this pandemic. Now at 343 deaths, we have seen more of our neighbors succumb to the virus in the month of January than any month this last 12 months. So obviously we remain very concerned about that and continue to work with our hospitals to monitor hospitalizations, and we extend our thoughts and prayers to those families who have suffered loss. Certainly, I know the toll of this virus, and frankly, with light at the end of the tunnel, we want to protect as many people as we can, and certainly we don't want to see anyone lose their life to the virus. Now, the positive news, however, is over the course of the last several weeks, we actually have seen the positivity rate drop. We're now at 6.95% positivity, which is a 29% reduction in positivity these last 30 days. So we've actually seen a relative decline in positivity rates, which is promising, but we're still seeing obviously a good number of positive cases. As a reference, today we're at 1,707 active cases. 2 weeks ago, we were at 1,314, and at our peak, we were at 1,860 active cases. Also, hospitalizations, you can see 2 weeks ago, 94 hospitalizations. We're at 162 at our spring peak, 108. Now, we did, however, see over the course of the last several weeks, we were in the 150 to 180 total hospitalizations, and that's important to monitor. If you're watching regional, the positivity rate among our partners in the Mid-Hudson region, Dutchess at 6.8%, 7-day rolling average. Yesterday's, today is at 6.95, right? That's what we just said. So 6.8, 7-day rolling average. Orange at 8.4, Putnam at 7.0, Rockland 6.6, Sullivan 6.1, Ulster 5.5, and Westchester County 6.7%. So if you're watching on Facebook, you have a question, write it in the comment section below the live stream. We want to welcome you again. This is County Executive Mark Molinaro. You're joining thousands of your neighbors on a Facebook Live telephone town hall, and we've been calling thousands of households across Dutchess. If you're on the phone and have a question, dial 0. If you are watching us live on Facebook, please just write your question in the comment section. We'll get to as many as possible. We are joined this evening by Dr. Anil Waithian. Dr. Waithian is our Commissioner of Health, infectious disease doctor in his own right, and Dr. Michael Gowitz. Michael and Dr. Gowitz, is the physician-in-chief at Maria Ferrari Children's Hospital at Westchester Medical Center. And for those of you watching us live, we're going to have Dr. Gowitz on the screen with me in just a few moments. So, what we're going to do? We're going to go right to Claire. Claire had a question regarding the vaccine. Good opportunity to start that question. Claire's from Poughkeepsie and had a question regarding the effectiveness of the vaccine. Claire, go right ahead and ask your question.
Well, I wondered how soon after we get the second dose of the vaccine we're likely to be pretty much fully protected, or as protected as we're going to get, I guess.
Great. It's a good question and a good place to start. I'm going to start with Dr. Gowitz. And Doctor, what I'd like you to do is, this is a reminder that currently two types of vaccines, or two produced vaccines being distributed throughout New York State and in this region. The Pfizer and Moderna vaccines, both are double shots, right? You get a first shot and a second shot. Let's do this. What is the effectiveness of the first shot? How long after the first shot does one need to wait to get the second shot? And then what is the effectiveness after the second shot? Dr. Gowitz, go right ahead.
Sure. Good evening, everyone, and thank you, County Executive Molinaro, for hosting this event, which is really very important. And we hope that there'll be a lot of learning tonight and reassurance as well. So, as you mentioned, there are two vaccines currently available. There may be a third one coming within the next month or so. Of the two, they're both fairly similar in nature. They are what are called mRNA-based vaccines, which, to make a long story short, create a mechanism in our bodies at the cell level to stimulate antibodies against the part of the virus itself that attaches on to our cells. So both of these vaccines require two injections. The Pfizer-based vaccine requires one initially, and then at approximately 3 weeks, plus or minus a couple of days, for the second, and the Moderna about 4 weeks for the second, again, plus or minus. These vaccines are very effective. Both of them are 90 to 95% effective when the course of immunization is completed. And there's an interesting graph that was developed early on in the trials that were done in many thousands of people. And the first vaccine dosage at about 2 weeks yields a reasonable antibody response in the order of 50 or 60% effectiveness. And the second vaccine dose within about 10 days to 2 weeks brings that up to 95%. So after completion of the course and 2 weeks into the history of the second dose, you're most people are about 95% covered. That means that 95% of the time you will have an adequate antibody response to mitigate, to counter the effects of acquiring COVID-19 infection or SARS-CoV-2 infection.
Terrific. Thank you, Doctor. We had a question online from Renee. She was lucky enough to schedule her vaccine appointment for tomorrow. I assume at one of the Dutchess County pods. Will be at the former JCPenney's in Poughkeepsie. This is a point of distribution where we'll be distributing and vaccinating with the supply we have. She's worried, Anil, Dr. Wythian, after receiving her first shot, about making sure she gets her second shot. Why don't you talk, if an individual is coming to, and then we'll get to some more detail, but if an individual is coming to the Dutchess County points of distribution, Anil Wythian, what do they need to be prepared for, and what's the process, and what's the guarantee on scheduling the second dose?
Thank you, Mark. That's a great question. Typically, when they come the first time, they have gone through the eligibility questionnaire and they have gone through the online scheduling process. And so when they come to the pods, we have the registration information, basic demographics, and what we do is review some of the questions with regard to past medical history as it relates to side effects that they've had with other vaccines, any serious reactions, any medications that may complicate the immune process. And once they receive the vaccine at that particular date, before they leave, they're given an appointment for the second dose. Once they're in the state system, the state automatically will schedule the second dose to arrive for the follow-up pod date. And currently, we are going through our census and our prior vaccine rolls to make sure that the second dose population will be getting an email or notification on where to go for the second dose.
So one thing that we guarantee at the county points of distribution is that you will get scheduled for your second dose, that you will not leave without that schedule unless, and the only reason that wouldn't happen, and it did happen once, the state database that we're required to use crashes. And if it crashes, which does happen from time to time, the Medical Reserve Corps staff, volunteers, and the health department staff will take your information and follow up with a confirmation of that second dose. But to Dr. Wythian's point, as new doses are allotted to the county, we will be sure to secure your dose in those allotments. So assuming they don't decrease, there certainly is no risk, and we are seeing increases in distribution over the course of the next several weeks, which is a good time to take Raphael's question. The question was how many vaccines sent to hospitals in the distribution schedule. I'll let Raphael ask that question. I have a little bit of feedback there, Raphael, if you want to turn down your radio or television, maybe.
This information that's circulating out there, deliberately circulating by evil people.
That's that? Oh, he's listening to something else. So why don't we, I can't hear him. We'll go back to his question. Chris, why don't we cut off Raphael? Thank you. Doctor, a lot of feedback there. Dr. Wythian, his question, though, was about the vaccine, how much the distribution to hospitals, and how does this work. So why don't we talk a little bit about the logistics First, keep in mind that Dutchess County does not have a supply in our basement, right? This is entirely orchestrated by the federal and state governments. Now, county health departments, by mandate, and by the way, you pay as taxpayers, have funded county governments across New York to develop vaccine distribution plans. We updated that plan in October with expectation that we would launch that with the COVID-19 vaccine. The state of New York chose not to launch those plans and instead focused distribution from hospital coordination. And each region, the Mid-Hudson region being one, has a designated hospital hub, a coordinator. Ours is Westchester Medical. They're doing a great job with what we have. However, the entire system in New York, I'll say very candidly and politely, is very micromanaged. And because of that has caused a great deal of frustration. So you're at home thinking, I can't get my shot. I can't stand that I have to wait for an email from whomever. How do I get my vaccine? So let's talk a little bit about the distribution first and foremost. If you go to the state website, just so you know, there's a vaccine tracker. You can see the allotment sent to each of the to the states from the federal government, and then the numbers that get distributed to the Mid-Hudson Valley. And just as a reference, we are 126,000 total doses administered in the first and second week of distribution in the Mid-Hudson region. But just so you know, Sean, if you bring up the New York State vaccine tracker, the week-by-week bar graph, the federal government distributes an allotment. Week 1 was the second week of December. New York received 90,000 doses. That went up to 392,000 and then declined in weeks 3 and 4 to 160,000, respectively, 201,000 and then 160. The second week of January, we were at 209,000. This week, we were at 250,000 vaccines distributed. That was actually the 18th through the 24th. So New York State gets 250,000 doses from the federal government and then distributes those to the counties for use. Some were distributed to hospitals. In the last 2 weeks, no hospital received any new dose for first-time doses. So the hospitals are only, last week and this week, able to provide doses for the second dose to hospital or healthcare workers they provided the first doses to. Other doses are distributed to county health departments like ours, although a very small amount, and some amount to pharmacies. So who can distribute those vaccines is determined by the state of New York, and how many doses those organizations will receive determined by the state of New York. Dutchess County's health department last week had 700 doses to distribute. This week we have 600 doses to distribute. Now the good news is the Biden administration, President Biden's administration, has suggested that they're going to increase the numbers that we receive week to week, and that we'll be in a position to project out several weeks of vaccines. New York State will not permit the county health department or anyone else to book an appointment until we receive the doses in hand. So we don't receive the doses. Let's say we received those doses yesterday. We could then schedule appointments. New York also says who we can administer to. And so to bring up that chart, these are phased distribution. This is a phased distribution. New York State says we're in 1A and 1B. That's healthcare workers, certain individuals who work in congregate care facilities, but that also includes anyone older than 65, first responders, public safety communicators, others, a lot of public essential employees. So that said, New York State is saying that hospitals are only to give doses to healthcare workers, and in this case, as I said, the hospitals this week and the week before, only second doses for hospital and healthcare workers, no first-time doses. County health departments are asked to give priority, this is where it gets confusing, priority to essential public workers, and that's everything from emergency responders to school teachers. And then we are also supposed to not decline other populations, so it becomes a little bit complicated. So here we are in the midst of this distribution. Dutchess County has 600 doses to give this week. Doctors, we have Gary on the line, and I'd like to. Oh, I'm sorry. Let's finish with Raphael's question. So that is the distribution process. Dutchess has 2 points of distribution currently, public points of distribution, one in the town of Poughkeepsie, one in the town of Dover. We also have capacity to do mobile vaccines in certain locations. We did one in Pleasant Valley with those living with developmental disabilities. We're going to be out in Millbrook next week to do something similar. As doses increase, we'll expand where we can provide access. And our job, our goal anyway, is to expand the capacity of the distribution at the permanent points of distribution, Dover and Poughkeepsie, but also create more opportunities for mobile vaccinations in locations where we can set up, have emergency care provided, and can get folks to those locations. So as a for instance, we might find our way to a firehouse or to a public building. We would do that jointly with, let's say, a public health provider. It could be a hospital, could be a healthcare provider, could be emergency response. If it's a homebound senior, we might be able to provide some transportation to that location. But this is all in the weeks to follow. Right now, New York State only giving us enough, not even enough, only giving us 600 doses to really provide access to a very, very small number. And we apologize in the system, but it is sadly the system. Deborah, will delaying the second vaccine make it less effective overall? Good question. And can children get a vaccine? So what we're going to do is I'd like to open up to Gary. Gary had a question regarding a medical condition and whether or not one can get the vaccine. And then I'm going to throw both of those questions to our doctors. Gary, go right ahead and ask your question.
Good evening, Mark. Thank you for taking my call.
You're welcome.
Unfortunately, last year I was found to have prostate cancer, to which I went through the 45 radiation treatments. And following that, I ended up with bladder cancer in 2 separate areas. My question is regarding, obviously, your immune system is compromised once you're under that type of cancer treatment. Whether or not the vaccine will eventually be available through, like, the Dyson Cancer Center at Vassar, or through the various urology centers throughout the county.
Well, Gary, I hope you're doing well, and I appreciate the question. And you're not alone. There are a lot of folks with medical conditions that are not yet eligible. So first, if you're 65 years of age or older, you do have access, although limited allotment. Second, the state has certified. A couple hundred individuals who could administer the vaccine. So medical providers will have the ability to administer the vaccine. There's just not a supply for them yet. So the short answer is locations like the Dyson Center and other networks will have the ability to vaccinate. There's just no vaccines yet to give them, and so that's where we are at this point. Now, if you have an underlying medical condition and you're not 65, you currently don't qualify. And again, that's something that we've talked to the state about. We do know that there are those with significant compromised immunity and transplants, developmental disabilities that are really vulnerable, but don't fall in those categories. Again, with limited supply, the demand exceeds that. But doctors, let's start with. But Dr. Gowitz, let's roll in Gary's general question. An individual with a medical condition, assuming his or her physician says, "Go ahead, you can take the vaccine." What do we know about the vaccine, its effectiveness for individuals with other illnesses? And secondly, if you have COVID, right, you've contracted the virus. What do we know about the vaccine and its effectiveness while you're still carrying the virus? And what's the recommendation on when you should wait to get the vaccine? I know that's 3 questions in one, but I'll give that to you, Dr. Gowitz, if you don't mind.
No, I don't mind, although certainly Dr. V can comment as well. There was also part of the question, I believe, was about children's access to the vaccine.
Yeah, that's another question as well.
I'll take that first. That's my bailiff. And while there is currently just starting both the Pfizer and Moderna vaccines are in a trial for children 12 years of age and older, there is currently no access, even under emergency use capacity, for children to receive the vaccine. We're waiting to see what those test results in approximately 2,000 to 3,000 children who are in the trial, just starting, will yield in terms of their responsiveness to the vaccine, the durability of the vaccine in them, and whether they are more accountable for any side effects. So, no, the answer is currently children are not accessible to the vaccine. In most cases, and as I say, Dr. V can fill this in further, but in most cases, underlying medical conditions are not a contraindication for receiving vaccine. And there are a few circumstances where that isn't true. For example, chronic autoimmune diseases where people have trouble mounting antibodies or sometimes inappropriately mount antibodies from an underlying abnormality of their immune system. And I think as part of the last question, can you get the vaccine when you've had COVID? Yes, you can. The question is, it is unclear how long antibodies last after a COVID infection. Even now, although there are data that suggest the worse the COVID infection you've had in terms of your body's response to it, the more likely you have antibodies that, if you are otherwise capable of making antibodies, that last long. But a mild or even an asymptomatic infection with COVID, and there are people who don't know they've had COVID, in those people that have been studied under that circumstance, there is some question about the durability of the antibody response. Dr. V, you might have other comments on that?
Yeah, and I actually, Dr. V, while you're answering that question, there was a question about delaying. What if you miss the second dose and you delay it a week or two? Do we know much about the effectiveness after that sort of 3 to 4 week window, Dr. V?
So the guidance is to stay on schedule, but from my reading, even if there's a delay in getting the second dose, we would not change, additional doses or recommend additional doses. Getting the second dose, regardless of any delay, would be counted as being vaccinated. With regard to any contraindication, I just want to reemphasize that the only major contraindication to getting the vaccine would be if you had a serious reaction or anaphylaxis to this type of mRNA vaccine. And given the fact this is totally new and very few people have experienced it, this is not a common phenomenon. And yet, millions of people have already received the vaccine. There have been reports of anaphylaxis, but the rates of anaphylaxis are extremely low, and they typically occur in people with a known history of severe allergies. And in these individuals, we tend to monitor them very closely.
And so to go back just to one of the comments or questions that Dr. Gwitz referenced, yes, you can certainly, we understand medically getting the vaccine if you have contracted and you're actually carrying, right, you have COVID is permissible, right, that it'll be effective. But keep in mind, right, the reason we wouldn't want you to do that is one, you should be quarantining under the guidelines, and two, of course, we don't want the virus spread to other people. But the vaccine itself, Anil Waithian, seems to be effective even if you're carrying the vaccine. And with that, we had, I think Linda on the line asked a question. We won't go to her live, but the question was, if I've had COVID, do I really need the vaccine? Do you want to answer that, Anil?
So again, I'm going to piggyback into a comment that Dr. Gwitz mentioned. People who tend to have significant clinical presentation of COVID probably have more robust and long-lasting immunity. And so the vast majority of individuals who are tested positive may have mild or asymptomatic disease. And in these individuals, we really do not know how robust and long-lasting that immunity is. So if they have the ability to get vaccinated, even despite a history of a positive coronavirus test, we would recommend that they get it.
I appreciate that.
Let
So,
me just add one other,
go ahead, Dr. Gwitz, go ahead, yeah.
one other. Early on in the vaccine development and history of giving it, there was some concern raised about pregnant women and women who are breastfeeding and whether the vaccine would be appropriate for them. More recently, however, with experience with the vaccine, there has been now recommendations by the American Academy of Pediatrics, American College of OBGYN, that pregnant women can receive the vaccine and that lactating or breastfeeding women can receive the vaccine. Of course, there's always the caveat that people in any category of concern should check with their personal physicians, obstetricians, pediatricians, et cetera, to decide in their individual circumstances whether these more general rules apply. But given that caveat, we are now recommending that those particular women in those categories do receive vaccine.
Thank you for that. We're going to go through a few rapid questions. I know there are a lot on Facebook, so let's start with the most obvious. Can you get on a waiting list? You can't. New York State is not permitting us to develop a waiting list the way you would want it, meaning we could go put you on a list and then get to you as appointments become available. We're not permitted to do that. New York State is very clear. The only way that we are allowed to distribute vaccines at this moment, and we've asked for a different structure, but at this moment, is to alert you as to the availability, and then you have to, sadly, it's like chasing a unicorn, schedule that time when it's available. Believe me, this is not the way we would want it done, but it is the only way the state is permitting it to occur. So if you visit duchessny.gov and you go to the COVID vaccine tab, if you go to the COVID update, and then you go to COVID vaccine, you'll see a subscription button. Now, in the very near future, probably next week, that subscription will include a little bit more information. We'll ask you for some more details, so at the very least we can inform those that fall in different classes of different information. But as of today, we have something like 25,000 people. We have 32,000 people on the waiting list. That's the only way we're allowed to do it. It's not the way we would. And we have 600 doses. So when we get the doses in hand, New York State says when you get the doses in hand, using their database, we have to provide that information to you, and then it is a free-for-all, and it is awful, it is frustrating, and it is not the way you would want to do it. It's not the way we would want to do it. And I have to argue it's probably not the way the state would want to do it, but it is currently the way that is the only way we're permitted to do it. Now, we have a lot of questions about, well, what about seniors who can't get online and what have you? Absolutely. Number one, they're limited, but there are appointments still being had at the state regional vaccine sites. Those sites, one is in Westchester, one is in SUNY Albany. Those are the ones closest to us. If you go to our website and you look at the Am I Eligible section with New York State, you can do that online. You can also call a toll-free number. New York State will allow you to call 1-833-697-4829. If you're on the phone, you want to ask a question, dial 0. If you're on the phone now with us, you can dial 0, ask a question. But if you're taking this down, it's 833-697-4829. Those will only get you access to the state sites. Again, not the way we would do it. We want it all centralized. But if you go to the state site, you're only going to get availability of the state locations. They won't tell you any pharmacy that has it. They won't tell you any county that has it. They won't tell you any doctor's office that has it. Only the state sites. Other than that, that is the way the system works. I'm sorry. It's not the way we would want it done. It is exceptionally frustrating, and we are equally upset and frustrated with it. We're hopeful that as doses increase, we'll have greater availability with appointments. But just as a reference, Harold and about 1,000 other people have said they try to sign up, they can't sign up. We get it. Believe me, but I do want you to know I actually see them push send. I watch them hit that button. It goes to 25,000 people, and you then have that sort of that free-for-all to try to schedule the appointment. And yeah, you're right. If you're in front of your computer at that second, you might get it. Plenty of people get the one, your mother, but not your father. We have 600 doses this week to administer, and just as a reference, 70,000 Dutchess County residents currently qualify in the 1A, 1B category. Felicia asked, where do higher ed staff fall in phases? Hi, Felicia. They are in, no, it's bye, Felicia. Is it hi, Felicia? It's bye, Felicia. Hi, Felicia. Higher education staff fall in the 1B category. Higher education are in 1B. Diane asked about the waiting list. We're just not permitted to have one. Now, what we will, we did get a couple questions about assisting senior citizens. Yes, we're trying to work out a structure where we can work with the pharmacies and through our Office for the Aging, give the availability to seniors. We'll notify you in writing, right? We have newsletter communication. We'll take phone calls, and we'll try to connect seniors with available appointments at the pharmacies. But again, in Dutchess County, just as a reference, 600 doses to the health department, 600 doses to the pharmacies. That's a lot of very few doses for countless numbers of folks. Nancy, when will doctors' offices have vaccines? Great question. When the state says so. And so the state has authorized doctors' offices to provide vaccines, but with only now this week 1,700. We have a total of 1,700 doses coming into Dutchess County this week. That's not by the way, we're not being shorted compared to other counties. We're all receiving about the same. It's just the state directs a good number of their doses to these regional sites. The site in Westchester, somewhere between 7,000 and 10,000 doses go directly there. And we've been arguing we want more doses locally so we can get to neighborhood distribution. We can get to folks who might not have access otherwise. Kathleen was on the phone. She asked, will Dutchess get a state distribution center like the one in Westchester? Not likely. What likely happens is that we take the locations we have and expand capacity significantly. We could do 5,000 doses a week. We're just not, we only get 600 at the moment. So hopefully that increases. Answered Felicia's question, answered the question about the waiting list. Here's a good question. Dr. V, Diora asks, can I get periodic antibody tests? What's the value of doing the antibody testing at all, and why would one want one frequently, if at all? Dr. Nilwathian?
So, can you hear me?
Yes, go ahead.
Thank you, Mark. And so currently, I don't believe there's any data or guidance to recommend that. I will tell you there are quite a bit of tests that check for antibodies. For instance, when we do employment physicals, we check antibodies. The presence of an antibody doesn't necessarily mean somebody's immune or not immune. It all depends on the disease state and depends on the modality, whether it's an IFA or ELISA. So there are a lot of issues with it. Currently, there's no guidance in terms of following antibody level, and we don't know if it correlates with immunity or how long it lasts. So I would recommend against that unless we get more data which explains or answers that question.
Great. Dr.
Gwitz, would you want to opine?
Yes, I would agree with that. There are certain circumstances, as you said, such as employment physicals or other scenarios where it could be important to know if you've developed an antibody response, or, for example, you're going to be undergoing some type of extensive medical procedure, something like that. But under most circumstances, general population information is not proven, has not proven yet that following your antibodies tells you much.
Cecilia asked, which I think is a sort of an obvious question, if does the second shot have to be the same manufacturer as the first shot? Do you want to answer that in unison?
Yes.
Yeah.
Yes, it does, right? Yes, it does. But also a good opportunity, Dr. Gwitz, we know that Johnson & Johnson is very close to presenting, I guess, for emergency use, their single-shot vaccine. Could you? We had a good conversation yesterday about this. Could you explain what's the difference between the Johnson & Johnson vaccine and the Moderna Pfizer vaccines, and what should folks know about that one?
The Johnson & Johnson vaccine is more in line with traditional vaccines, but yet it is different. It is where information from the virus, the coronavirus, is attached to a dormant, inactivated adenovirus. Adenovirus is a very common virus in the community. Causes colds, causes other types of gastroenteritis, other types of infections that are usually well handled. And that has been inactivated, and components of the coronavirus, which is also not active in this situation, have been attached to it, and the adenovirus is what's called a vector, a tool basically for the immune components of the coronavirus to get into our cells and stimulate antibody production. So as a result, this vaccine only requires one shot. The difference is that the data so far, as we've heard, but have yet to be scrutinized by the FDA and its committees on safety and utility, suggests that it's only about 60 to 70% perhaps effective. So there is a difference there. Whenever I'm asked about which vaccine should I get, the answer is always the same. It's the one that you're given or offered.
Fair enough, right? Thank you for that, and I've heard you say that a couple of times. True, absolutely. So, but the Johnson & Johnson vaccine not available yet. It seems like it could become available within the next 3 to 5 weeks. It seems like that might be possible.
That's right. The data are supposed to be presented to the FDA subcommittee either the end of this week or sometime next week, and then the FDA process occurs with a final vote by the entire group for emergency use authorization in a week or two after that.
Great. We're going to go to Ken, who is on the line. Ken had a question regarding allergies and the vaccine. Before we ask you, Ken, to ask your question, Janice on Facebook asked, why not use a texting notification system instead of email? The short answer is we will be. It's not going to change much of the outcome. It'll mean that if you have your phone and you get the text, you'll be that much quicker among the 25,000 people to do that. But currently, if you sign up now online, right, you can go to our website. When you subscribe, you can subscribe via text message or email. We have the capacity to do both. So when you go to our subscription button at duchessny.gov, you can give us an email. You're in the 25,000 emails. You can give us 32,000 emails. You can give us a text message. But understand, we're going to hit send it again under the state system. We have to hit send at the same time. You might get it quicker, but you're still, you're still in this massive pool of people who all are supposed to try to get that appointment the same. It is not the system we want. It's the system that the state expects us to use at the moment. Ken, your question?
Yeah, my name is Ken Kurz, and I'm calling about the doctor had mentioned something about anaphylaxis and problems with food allergies and severe allergies. Can this shot be given to people with that kind of a problem?
Great question, Ken. Anil Wythian.
And because she has the EpiPen, and she's highly, even when she eats food, she's got to eat certain restricted foods and so on because any other kind of food outside of what she eats has a detrimental effect on her stomach. And if it gets severe, she blows up and you can't breathe. And it's very severe.
Sure.
Go ahead, Anil. Why don't you answer that question?
That's a great question. That's a great question. And actually, we've had several experiences of individuals who come to our pod with such severe allergy, nut allergy, or a history of anaphylaxis. Currently, as I mentioned before, the only contraindication is having a severe allergic reaction, such as anaphylaxis, to a prior dose of mRNA COVID-19 vaccine. Also, there are a couple of components within the vaccine, basically polyethylene glycol or polysorbate. We haven't seen this, but again, if people have an allergy to these components, there could be a cause for concern. But what we've done for people with a prior history of allergies to shellfish, to peanuts, or whatever, we've been extra careful. It's not a contraindication to getting the vaccine, but we've been very careful in our monitoring and making sure that we have them wait and sit and monitor them for a longer course. And we haven't had any issues with them getting the vaccine, nonetheless.
So on the line, we did. I'll just read Joyce's question. We're going to go to Rita in a second. She'll be the second question. But doctors, Joyce, Rita had a question regarding the first and second dose. But before we do that, Joyce had a question. She says she knows someone who received the vaccine but still got COVID. Is that possible? And the short answer is yes, it is, right? If you only receive the first dose, right now it's 50 to 60% effective. You receive both doses, you're at about 95%, but that leaves anywhere between 50 and 5% of the population could still contract the virus. Did I get my math right, doctors?
Yeah, exactly right. Unfortunately, there are very few things in life that are 100%.
Yes, except death and taxes.
Right.
And even
exactly
death,
right.
even death these days could be probably put off, but the tax man cometh.
Yeah, this is the same. I'm sorry. This is the same scenario where individuals get the flu shot and still get the flu, because again, there's always these possibilities.
Thank you for that.
Go ahead,
Dr. Goods.
Biology is not a perfect machine.
Indeed. And so, but again, that first shot, and Rita's question had to do with the first and second dose of the vaccine. Rita, if you're on the line, why don't you go ahead and ask that question?
Hi, yes. Thanks again, Mark, for doing this.
You're welcome.
Wondering, is there a difference in the strength, or is there any difference between the first shot and the second shot of the vaccine?
The answer is no. There are differences, some subtle differences between the two vaccines in terms of the concentration and strength, but no, the first dose and the second dose are the same.
Thank you for that question and that answer. We had a few questions that I do want to get to from Facebook. Mary asked, do pharmacies have vaccines, CVS and Rite Aid? Why don't we bring that slide up? I mean, technically speaking, they do. There's just not a large supply. And as I said, if you're trying to schedule an appointment with a pharmacy, it's not centralized, although we're working at it. So right now, Rite Aid, and I think Tops, but Rite Aid in Dutchess County has access. As I said, Dutchess County's health department had access to about 600 doses, and the pharmacies have about the same number. You are to schedule directly with them. Now, we are working, our Office for the Aging, Health Department, and Rite Aid, we are working to try to create sort of I don't want to call it a waiting list because it's not really that. It's just a pool of individuals who we know qualify, 65 years of age and older, and try to connect you with the pharmacy so you're not competing to try to get those scheduled, because the pharmacies are permitted and do have the capacity to take a schedule and sort of work on it over the course of several weeks. So I think that answers your question. But again, if you visit DutchessNY.gov, go to the COVID vaccine, and you'll find this information. Again, it's just a very disjointed process. We don't necessarily think it's the greatest. Well, no, we don't think it is at all. It's not even necessary. I don't have to quantify it. It's not a great process. We hope that it improves. Now, I do want to say on vaccine distribution, and in a few moments, Dr. Gwitz is going to have to leave us, but we'll get one or two more questions before he does. When it comes to the vaccine allotment, as I mentioned, the federal government distributes a number to the states. The states then divvy that up how they wish. The Biden administration has announced that there will be an increase in those numbers. So we do expect, moving forward over the next several weeks, that we will see an increase in the total number of doses. The other, which we think is equally promising and almost more important in some ways, is that they'll give a 3-week projection so that we can begin the process, we hope, once the state signs off on that, of booking appointments based on a guaranteed allotment. So again, maybe slow, steady increase in the total doses, but we'll be able to know week 1, 2, 3 the expected allotment, and then we can work with you to try to schedule a bit more efficiently. We do have a question from Richard, which is, I think, is a great question on the phone line. Richard, why don't you ask your question, and I might throw in a few softballs for the doctors to add to that question. Go ahead, Richard, ask your question.
Thank you. If I receive the vaccine, as hopefully I will soon, I understand that after the second dose, I may be protected up to 95%, but in visiting my children or my grandchildren, could I still carry the virus and infect them even though I'm protected?
It's a great question, and doctors, while you're answering that question, also talk about why do we still have to wear a face covering or mask after I receive the vaccine? Why is that important? So both of those questions. Why don't we start with Dr. Gowitz, because I know you're on a tight schedule with us.
Yeah, thank you, Mark. It is a great question. It's a great question in my own family, as I have grandchildren myself. And actually, both questions evolve from respond to the same answer, and that is currently it is thought that you can still harbor the virus and not get sick from it yourself because you've mounted an antibody response after having the vaccine, but you still are potentially infected. That is, potentially able to spread the virus to a vulnerable person. And that's why mask wearing, social distancing, intensive hand washing are still going to be recommended after the vaccine, after anyone has received a full course of vaccines. Now, there is a caveat, and that is this is a feature or an aspect of the situation that is currently under some really intense evaluation. With an abundance of caution presently, however, the recommendation is that you should be aware you still are potentially infective. That may change as more data come about with better long-range study, but that is the current recommendation, to consider yourself still a potential carrier of the coronavirus.
And so a lot of people ask about what this thing called herd immunity is. Dr. Wythian, what is herd immunity? And I think in answering that, you can build on Dr. Gowitz's answer, which I think speaks to why, we still have to take these mitigation steps. Because, again, even if you've been vaccinated, there's still not enough people who have either been vaccinated or have contracted the virus. And this concept of growing the herd immunity isn't achieved until those things occur. Can you talk to that? And I think I said that correctly, but I'll let you explain it.
Sure. Herd immunity is when you have a state in the general community or population where if you introduce an index case, the individuals that they're going to bump into or potentially infect, if they're already immune through natural disease or vaccination, cannot propagate this infection or the virus. And so if say 20% of the population is immune from through vaccination, and say 80% is not, then, if a case is introduced into a community, there may be quite a number of people they may bump into who are susceptible. But if 80% of those individuals that they meet are immune because of vaccine or natural immunity, then the likelihood that infectious person will transmit to another person becomes a lot less likely. And so that is the concept of herd immunity in action. Again, it's dependent a little bit on how infectious and how effectively a virus replicates. But again, the whole point of the vaccine program is to try to reach this this situation where when cases are discovered in the community, they're not leading to other cases.
Thank you for that
And
answer.
that's the short answer.
That's the short answer. They can hang on later for the long answer if they want. Dr. Gowitz, I know that you have to leave us at 6:30, so I'm going to leave you with this last question, and maybe if you'd like to offer a couple comments. Harvey, and by the way, for those listening, Dr. Anil Waithian's remaining on the call. Dr. Waithian, Commissioner of Health, also infectious disease doctor. Harvey asks, how long does the vaccine last? So, Dr. Gowitz, I know I've learned the answer to this question, but why don't you answer that question? And if you don't mind, just a reminder for folks, what should they know about, from your perspective, the vaccine? And I also want to extend our thanks to all of you at Westchester Medical for the leadership and the support you've given us. Go ahead. Harvey's question, how long does the vaccine last?
When you say vaccine last, I assume you mean how long are you protected and your antibodies last?
Sure.
And so that's a good question, and it's a question without a definitive answer, I'm afraid. It's still in the process of being studied. So far, the Moderna group has actually followed people from their original clinical trial and noted good response at least 4 to 5 months down the road from receiving their course of vaccine with good antibody levels. And it probably does last a lot longer than that from either of the vaccines. The question is it 10 months? Is it a year? Is it longer than that? That is yet to be determined. But probably the 4 to 6 month range is a reasonable estimate of high levels of vaccine for now. I just thank again County Executive Molinaro for providing these forums for the community. It's really important. I do want to make a pitch for people, number one, to really strongly consider getting the vaccine because it protects not only themselves, but does have an impact, as we said, with some caveats. But as we approach, as Dr. V mentioned, the level of herd immunity, it will have an impact on those you love and those you care for. So the side effects remain minimal. The current estimate is somewhere around 11 people get serious side effects out of 1 million doses rendered, and most of those are recoverable within a very short time. So the side effects are minimal. The personal advantage is great, and the community advantage is great as well. So please strongly consider this, and it's up to our colleagues in government at all levels, but in particular federal and state, to try to help us improve the availability throughout the communities of New York. Thank you again.
Thank you, Dr. Gowitz. Dr. Michael Gowitz is the physician-in-chief at Maria Ferrera Children's Hospital at Westchester Medical. For those of you who don't know, of course, Westchester Medical has made a significant investment in pediatric care here at Mid-Hudson Regional Hospital, and Dr. Gowitz has been a critical component of that. So thank you. Be well. For those of you on the line with us, stay with us. You dial 0 if you'd like to ask a question. If you're on the phone, this is County Executive Mark Molinaro. You're joining Dr. Anil Waithian, the Commissioner of Health here in Dutchess County, an infectious disease doctor, as we do our Facebook Live and telephone town hall meeting. So it's just you and me, Anil. Let's see if I'm not a doctor, but I play one on TV. So with that, let's get to a couple other questions. Betty has a great one. Will COVID always be around? Anil Waithian, will COVID always be around? Did I lose Anil? Anil.
No, I'm here. I have to think about that a little bit because, again, my response is, if you remember H1N1,
yeah,
and that was almost a decade ago, that specific virus is still circulating in the human population.
Yeah.
And so the short answer is yes, it's going to be around for the near future. And it wouldn't surprise me in the least if you're going to see cases of people becoming sick years from now because they were not vaccinated.
Okay. Thank you for that. We're going to go to Christine from Fishkill. Christine from Fishkill is on the phone line, had a question regarding distribution. Go ahead, Christine. Are you with us? Thank you for that. We're going to go to Christine from Fishkill.
Hello.
Hi, Christine. Go ahead.
I'm hearing about these distribution centers, and obviously there's a lack of vaccines, but I'm seeing everywhere in other communities that people are driving through, which is appropriate because we do not want to be gathering vulnerable people inside together for hours.
That's a good point. And at our distributions, you don't have that problem. But Anil, why don't you talk through the logistics first? Keep in mind, I'd offer Christine that the state of New York sets the rules, and they did not permit counties or really anyone to currently use drive-through vaccination. And I can't say I know why, other than perhaps the concern regarding adverse effects, the need to recover if there is a need to recover. But I will tell you one of the benefits of the Dutchess County locations, and we were what I tell people is county health departments have for a decade been required to come up with vaccine distribution plans. So the experts in the field all across the state actually develop these plans. We've got a great team. Anil Wythian, Kathy Tetmeyer has been running the logistics. Joe Ryan handles our medical reserve corps. There actually is a playbook for vaccine distribution. Not sure why we didn't have the playbook, but I mean, it's almost like what New York said is, a colleague of mine used this description. This is like a sporting event. We're in the first quarter. And guess what? New York State is down by a lot first quarter. And for whatever reason, they've kept their best players on the bench. and we're now entering the second quarter, and we've been saying, please, put the good players in, because the health departments in particular understand how to do this. So if you use one of the points of distribution in Dutchess County in particular, if you ever went to the Galleria, to the J.C. Penney's, you know that is a very large anchor store. And the way that layout works is that we don't have a situation where there is a backup line or people hanging around for hours. In fact, you're given your appointment. We're basically running on time with very limited delay, and the square footage in the facility is wide and open. So, Anil, walk through what happens. You show up with your appointment. What are the steps at the J.C. Penney's location for our point of distribution to allay any concern regarding sort of large congregating and long waiting? Anil Wythian?
Sure. That's a great question, Mark. Again, we have looked at all the variables that come into play when we plan our pods, especially in terms of safety of staff and individuals who come to the pod. So if you look at that physical space, it's a large space with a large volume of air. We do not let individuals into the space until they have the scheduled appointment, and so that we could maintain adequate spacing and flow. And so if everything goes well, when I say everything goes well, if the computer system, which is the state-based computer system, is working well, once people check in and we register them, the throughput or the time from registration to the time they leave the door is about 30 minutes. And 15 minutes of that 30 minutes is observation, where they wait after they receive the vaccine. So throughput and the time through the whole pod is quite quick. And we prefer this setup as opposed to a drive-through because, again, if there is anaphylaxis or a severe reaction, it's hard to observe individuals in their car. So we have not used that approach.
Right, and the concern, of course, is that you do want that few minutes of recovery time after the dose, regardless. And so the vehicle setup is not something New York's using, but other states are. And I will tell you, based on the calls that we've had, county leaders across the country, there isn't anyone who says the system they have is a good one. Everyone is sort of in the same basic kind of frustration, although I will tell you the New York system is universally more complicated as a process. I'm going to try to get to as many questions as we can. Kitty, are the 600 doses we get all given to Dutchess County residents? Could other county residents get in? The short answer is we're not permitted to deny a New York State resident, but what that also means is that there are plenty of Dutchess County residents who actually have gotten their doses in other counties. Now, Liz asked questions on Facebook regarding focusing our doses toward, she asks teachers, I'll say specifically towards those public employees that we're required to focus. So that actually gets to to Kitty's question as well. We've taken painstaking steps to try to be clear that Dutchess County residents, and in particular the state's mandate that we focus on essential workers, that they are Dutchess County residents. But the short answer is anyone can access that state database. So once the link is up and the appointments are available, anybody in New York State can get an appointment. Now, again, I will tell you based on what I've seen, and Anil, correct me if I'm wrong, but we know who's come through. I mean, I personally don't know the names of everyone, but I certainly know the zip codes. The folks who we've been giving vaccines to are overwhelmingly, and I mean 90%, Dutchess County residents. Does that sound about right to you?
Yes, that sounds about right. We do have individuals who come from other parts of the state, but overwhelmingly they are Dutchess County residents.
Thank you for that. And Liz, so what we've done to focus, we don't want to be in a position of denying people of all backgrounds who currently qualify. So what we do each week, once the allotment is given to us, for those who are essential public employees, and that's the category that New York State says health departments should focus on. We don't agree that should be our sole responsibility. So counties are working ways to ensure that there's some opportunity for others. But what we've done is we provide the school districts and the supervisors and mayors that are responsible for employing those essential workers. We give them the same notification, sort of corralled in a way that allows them to schedule appointments. So it's a percentage of the whole. At any given day, we're trying to balance it out as best we can. As we get more doses, the likelihood is we will establish mobile clinics where we might come to a single location, try to get individuals who live close to that location there. But until we get more doses, we're just trying to balance between the essential public workers, which is a large category. It's school teachers, emergency responders, it's dispatchers, it's a whole host of others, including school teachers. So that's the balancing act that we've got. Now, Liz also asked, though, that why are students able to participate in high-risk sports but not sit in a classroom? Well, great question, Liz. The short answer is they can sit in a classroom. New York State makes it very clear that school districts can open and can function as they desire, but certainly long periods of time in close proximity has caused school districts to establish basic precautions. And those precautions include lesser capacity in the classroom and some distancing. Now, Dr. Wythian, you know that the state of New York, to use a bad and overused sports analogy, punted the decision. Did you like that one? Punted the decision on high-risk sports to county governments and the health departments. We recognize that there is a degree of risk, but the 7 counties in the Mid-Hudson region agree time to allow these athletics to continue. We have allowed other lower-risk athletics to go underway, but we've established basic precautions. But Dr. Wythian, you were clear, and if you want to talk a little bit about this, the difference between sort of going to school and these extracurricular activities is that you're choosing to take on a certain amount of risk by participating in them as opposed to the equitable access to education. Now, I'm all for getting schools more populated. My kids are in a hybrid model, and there are days that it just, well, anyway. Got a great school district, and we love our school district, but real challenges in that hybrid model. But Dr. Wythian, you were pretty clear. At the very least, parents, schools, and students need to acknowledge that they're assuming certain risks when participating in those athletic activities. Do you want to just offer a comment about that? You don't have to go too deep on it.
Sure. So again, we know from the data that's available, and in fact, the CDC has given guidance on this also, that the classroom setting is low risk. It's low risk because of the environmental and administrative control measures that they've taken. Part of it include decreasing the number of individuals in a classroom, physical barriers, mask wearing, hand and respiratory hygiene, and cleaning. So all those measures have had a tremendous impact in reducing the risk to faculty as well as students in the classroom setting. Now, with regard to high-risk sports, when you have two individuals who are wrestling on a mat and one is symptomatic, I cannot stress the risk to that other individual. And so, again, what the school district, what parents, and what the community needs to know is engaging in these activities are putting individuals in a situation where there is risk. But we also acknowledge that, again, in this population, the need to be physically active, the mental, social, developmental, benefits of engaging in these activities are also to be weighed in deciding whether a school district or a particular school wants to resume. And so, again, as Mark mentioned, these are things you have to weigh the risk and the benefits.
Thank you, Neil. Two questions that we got. One from Ronnie is on the phone, and the other from Jeanette. Want to volunteer, and so if you're interested in volunteering with us, certainly you can sign up for the Medical Reserve Corps. Visit duchessny.gov. There's a search bar. Just type in Medical Reserve Corps. You can still sign up. Janet's question specifically is that if she's a retired nurse and she wants to be a vaccinator without receiving the vaccine. Number one question, Anil, if you're going to be a vaccinator, must you have been vaccinated?
The answer is no. Quite a number of our MRC avail themselves of getting vaccinated, but that is not a hard and fast requirement.
But we obviously would be monitoring your health conditions, symptom. If you're at all, if not feeling well,
Absolutely.
you're not participating. So that's important, right?
Absolutely. There's screening and there's all these guidances we follow before they're allowed to be on site.
So we have a few questions that I think are pretty obvious. What about those that have comorbidities, et cetera? I want to go to Bill. Bill is in Millbrook. Bill had a question regarding accessing the vaccine with underlying conditions. Bill, are you with us?
Yes, hi, it's Bill. I was wondering if, in fact, the New York State has not determined, other states have determined what constitutes an underlying condition when the time comes. I know we're not at that phase yet, but when does New York plan to determine what those are?
My experience with New York is at the very last minute. But Nell, we also have a question from an individual. Gregory had the question: why don't they just focus on 65 and up with comorbidities? Do you want to take? I mean, I know you don't know when the state's going to make that decision, but can you talk a little bit about? This state has chosen not to focus on 65 on those with underlying illnesses, where there are certain states that have. Do you want to talk a little bit about that and perhaps just answer Bill's question to the extent you can about what we know on that decision making?
Sure. So while indeed we acknowledge that individuals of a particular age group are at high risk for morbidity and mortality, whenever you do a vaccine rollout, the ACIP, the advisory committee, they do vaccinations when they want to vaccinate everyone in a population in sort of like a staged manner. And so it's important that, again, the individuals who are at the highest risk, especially those that are in healthcare setting and patient-facing or public-facing, be vaccinated, because they are the population which will be doing the vaccination and taking care of the individuals in this age group. And so, that's what the state has chosen to do with the 1A and 1B designation. And now that also includes individuals in 1B of 65 years of age and older.
Thank you for that. If you're on the phone line, this is County Executive Mark Molinaro. You're joined this evening on our telephone and Facebook Live town hall by Dr. Anil Wythian. Dr. Wythian is the Commissioner of Health and Infectious Disease Doctor in his own right. If you have a question, dial 0 on the phone. If you're following us on Facebook, write it in the comment section below the live stream. I know that there is a great deal of frustration regarding accessing the vaccine. As a reminder, currently there are about 70,000 Dutchess County residents who qualify under the 1A and 1B category. Dutchess County government has access this week to 600 doses. We do encourage you to sign up for our notification. If you're sitting at home thinking that you haven't gotten many notifications regarding availability of doses, it's because there aren't that many doses available. But we do provide under the state guidance. And again, the state of New York corrals this entire structure. It is not the best model, but it's the one that they're using at the moment. We hope it improves. We think it will. If you visit dutchessny.gov/COVID vaccine, click on the subscribe now button. You can give us your email. You'll join 32,000 other individuals, and sadly, we are only allowed to notify of those availability when we have doses in hand. We are not permitted to schedule in out weeks, although we think with the federal administration talking about multiple week projections and distribution, that should change. We also can't keep a traditional waiting list as you would expect, right? It's not like going to the grocery store and you pull the ticket. We're just not permitted to do that by the state. But you do have a couple options. You can sign up for our information via email or text message. So we do both. You get both. Both will be provided if you provide that information. We'll continue to enhance the portal, so we'll get some more detailed information from you. And at the same time, we hope within the next week we'll have the ability to work with our pharmacies to assist in particular senior citizens who may not be as technologically savvy or may have some ability to connect, will have some ability to connect you with pharmacies. But right now, that is the structure we have. Now, Rita was on the line. She's been on the line a little while. Rita from Pleasant Valley is asking specifically about the number of people to get vaccinated. Rita, are you with us? We'd like to go to you live in 1 second. As soon as I get the thumbs up. Rita, we lost Rita? Rita? No luck? Oh, Rita, if you're with us, ask your question. I apologize. We were having a hard time getting you live. Go ahead.
Oh, no, that's fine. My question was about how many people in Dutchess County, because I don't know how many people are actually in Dutchess County, and I know we get so few in the vaccine.
I can.
I know. I'm just a little flustered. Okay.
You should
I'm sorry.
be.
I'm just a little flustered because I'm really sick of the way all of this is being managed, even by you, because no one is making any kind of a big stink about anything. If 600 doses are coming in for 70,000 people, I think that's a little bit ridiculous. And in the end, yes, the shortages is there, and it's not your fault, and it's not the fault of the state. It is the fault of the fact that they just haven't been able to make enough of the vaccine to distribute to everybody. But my other concern is I am a compromised individual that's over 65. And personally, I don't know that I would want a vaccine where I would only be 60% covered in a dose, whether it's one dose or two doses. Personally, I would rather be at 95%.
Well, you would be. So let's.
And you're also saying that there wouldn't be any choice with the way this is all set up, because if I schedule an appointment, I'm going to get whatever you have. And if I can't get an appointment until March or April or May, because right now I have gotten your notices, and within 2 minutes, it's already gone.
Yeah, I think so. Why don't I try to? We're going to keep you live because I think I'd like to go back with you a little bit. I'm always willing to take the criticism. So first, with all due respect, I can assure you we're making the biggest stink we possibly can. We've been on the state and the federal government regarding distribution. I do want to touch on one thing.
I don't hear it on the news. I don't hear it publicly on the news anywhere.
Rita, I will. If you wish, you leave us your email address. I'll show you all of the news that then covers. I don't write the news, but I can tell you we're on calls every day with both the governor's office and the healthcare leaders in the Department of Health. We have made this a single argument, and the reason we have is twofold. One, it is important. You are absolutely right. They can only give as many as they have. So the federal government only had so much to distribute, and that's limited. But secondly, I will take issue. The state of New York made a decision, and instead of distributing those vaccines to local departments to get to individuals in neighborhoods like yours, they decided to take tens of thousands of doses and give them to state those regional sites. So when you call and you said you can't get an appointment till March or April, you're absolutely right. But those are the state locations. The Westchester site, for instance, gets 10,000 doses. What we're saying is, instead of directing New York, all of those there, give the counties and local health departments more of a supply so that we can get through more numbers locally more regularly. Now, I do want to talk about the science because I do want to be clear. You are correct. We provide the dose that we have. So if we're given the Moderna shot, that's the shot we are able to provide you. You can choose to wait until the Pfizer shot's available or the Johnson & Johnson shot. But when you get that first dose, you are at 50 to 60% effective, right? It is the second dose that gets you to 95. So under every circumstance, you're going to be scheduled with us for the first and the second dose. That second dose is the one that gets you that 95% coverage. So no one is suggesting that you should only get the one and not the second. But you are correct.
Wait, hold on, because the doctor that you had on before had said the Johnson vaccine is about 60%. That's where you would be, at 60% or 65%.
No.
So that's the one that's coming up in March.
No, so
I don't think I misheard him, but that's exactly what he said. So if by the time I'm able to schedule something, and that's the only vaccine you have, then I wasted all that time waiting and making that scheduled appointment, denying someone else a shot to get a vaccine that I don't want.
I love you, Rita. No, that is not true. The Johnson & Johnson shot, if Dr. Guwich said it incorrectly, I'll certainly Dr. Wythian.
Maybe I heard it wrong, but it sounded like only 60%.
That's perfectly fine.
I heard.
That's perfectly fine. So what I'll do is, why don't we have Dr. Wythian talk about the effectiveness of the Johnson & Johnson shot. It still is estimated to have the same effectiveness. But Dr. Wythian, what do we know about the effectiveness of the Johnson & Johnson shot?
So, again, the Johnson & Johnson shot, we don't know a lot of data on it because, again, it really has not gone through the FDA review process. But, again, the preliminary data in over 11,000 individuals tested look at roughly effectiveness between 60 and 70%. But remember, the Johnson & Johnson shot is not an mRNA vehicle. It's a different methodology. And I want to just couch, effectiveness in this respect. Every year, people get a flu shot, and population-based data shows that in any given year, it's only 50 to 60% effective. But as a population tool, it's very effective in preventing morbidity and mortality. And so just looking at effectiveness is doing an injustice to the whole concept of getting a vaccine. There is value in getting your immunity up and preventing you from having severe illness as opposed to a milder case of illness.
And when matched with the numbers that will have received one of the other vaccines and perhaps contracted the virus, that's how we move closer to being able to control the virus. Is that about? Did I get that about right, Dr. Wythian?
Yeah. So again, as Dr. Guwich mentioned, I would use whatever vaccine is available, because again, there is value in getting it. And that getting a high number of individuals vaccinated and natural disease will get us to that level of herd immunity that's needed.
So, Anil, I think it's fair to say in my defense, and I'll only do this once, I don't know that any county executive could be more annoying than I am. When it comes to arguing this point. In fact, most of the time we get criticized for complaining too much. But the good news is regarding vaccine access, Rita, we always offer a solution. We've said to the state, we understand there's limited numbers, but as I said, rather than directing all of those doses to the regional sites, perhaps sharing them in a more wide distribution would make sense. But let's also talk a little bit about the vaccine. Remember, Rita, to your point, and to those listening, you cannot schedule a Dutchess County dose anytime beyond the next 6 days. We are not scheduling. We're not permitted to schedule into April and May. So it's not as if you schedule with us, you'll be required to take what we give you 6 months from now. Right now, Dutchess County is administering the Moderna shot. On occasion, we switch to the Pfizer shot, depending on what we have. And if you are able to schedule your appointment, and we acknowledge the limitation in doing so, if you're able to schedule your appointment, you're going to get those, and you're going to get the first and second shot of those, and that reaches that effectiveness in that case. We don't know yet what the Johnson & Johnson shot will look like and how that's going to be distributed. At the moment, we expect to be distributing the Moderna and or the Pfizer shots for the foreseeable future. If we're required to switch that, then you'd be notified. But more importantly, we're not the only ones doing this. Healthcare providers and others will have access to these doses, and when there's more availability, you'll make that decision. But I do think that that's important to recognize as well. Jane asked, what about Eastern Dutchess? Why is JCPenney's getting all the appointments? Well, JCPenney's is not getting all the appointments. Last week, we were able to, actually, I think we administered more in Dover than we did at the JCPenney's location. Based on the number of doses we get, the health and where we need to distribute, the health department will make a decision as to which sites are available. So this week we decided to do a mobile site for those who live in congregate care settings. We did that in the town of Pleasant Valley on Monday, and then the rest of the doses this week will be distributed at the JCPenney's location this week. We have the Dover location was open the last 2 weeks. We expect that we will have the Eastern Dutchess location again open next week. You should also keep in mind we're planning to open a more permanent presence in Eastern Dutchess that doesn't rely on the school district. So as we make that turnover and there's greater availability, we'll be doing that, and so there'll be greater opportunity as well. I know that there are a lot of questions regarding trying to get an appointment, so we're going to run through that one last time. I know we're going to have to cut off the phone line in a second. We only have 90 minutes on the phone, and we've exhausted those 90 minutes. Before we move on, though, so we're going to be live again next Wednesday, 3 o'clock, Facebook Live. Appreciate the questions. That's only Facebook, 3 p.m. But the next telephone town hall will be February 24th. It's Wednesday, February 24th, 5:30 to 7 p.m. We'll be doing the same again. If you want to get a vaccine, New York State does not permit the county to schedule, to establish a waiting list, or, as Terry asked, why not better prioritize elderly and immunocompromised individuals? Terry, absolutely. The county is not permitted to do that. We have to function within the rule established by the state. We are, to Rita's point, pushing back a lot. We've pointed out some of the deficiencies in the system, but we're not allowed to do more of the prioritization than what the state has permitted us. And the state has, by executive order, dictated that counties focus on essential workers. Now, we're working to balance that out as best we can so that we don't deny others. But with only 600 doses each week, there's just so many that we can access. Now, if you do want to schedule an appointment, you have a few ways to do that. First, visit DutchessNY.gov, COVID vaccine, sign up for the subscription. I know it's frustrating. I know it. And I'm not even going to tell you to be patient because it's patronizing to say so, although I wish we could. But if you sign up each week, we are not permitted to tell you that we have any appointments until we get the doses in hand. New York State delivers those to us on a day, and then we have to tell you all equally when that availability is. We do that via email or text message. You can sign up either with email and or text message. And for now, since there's so few locations, it is so frustrating and so few doses, so frustrating to have to compete. And I understand that, and we don't want it that way. It isn't the way we want to do it, but it is the way the state's doing it. If you want to access one of the state regional locations, you can visit our website and you can go to the state tab, or you want to call 833-697-4829. That's 1-833-697-4829. That is the way that you can access the state locations, but they're even scheduling weeks and months out. And it's the demand exceeds the supply. We do know that there will be more doses coming our way. This is the system the state of New York has established. It is not the one we want. It is the one we have. And we'll continue to advocate to get more doses, to create more opportunities. We want to do more mobile locations where we'll pop up in a town, Eastern, Northern, Central Dutchess, and provide sort of direct access, but we cannot do that until we're provided more doses. We appreciate the question. There was a Carol. You know what? Somebody did ask me. She asked a question. I never answer her questions. Is somebody on Facebook saying I never asked her question? Because I wanted to make sure I did. I can't find it. I'm using my handy, trusty little watch here. My wife gave me this wonderful Apple Watch. I wanted to let her ask this question, and I lost it. I apologize. I can't seem to find it. I think it was Caroline or Karen. Is there somebody there? If you're out there and you say I never answer your questions, I'm going to give you one last try. If you're on the phone line with us, we're going to have to shut down the telephone. We'll stay live on Facebook for a little longer. We appreciate you being on the call with us. You can reach us. You can follow us at Facebook, and of course, if you have questions, reach out to us via duchessny.gov. I apologize. Catherine Carino, that's her name. Catherine Carino, what is your question? If you type it in the Facebook Live, if you're following us right now, I don't know that. Let me see if I can find it. I feel badly. Let's see. She has multiple sclerosis and direct care professional and 69 years old. Do you have to be a special type of person to get questions asked? No, you don't. My brother asked a question. He gets, Catherine, I am happy to, I really want to answer your question because I don't want to skip over you. What is the question? And I'll answer it. Let's see if I could find you. I apologize. I never do this, but I don't want you to feel as if we're not answering your questions. What is your question? Do you have to be a special type? No, Catherine, she's asking me the question right now online. This is live. You need to get the vaccine. You have MS, and you'd like access. I understand. What I want you to do is go to duchessny.gov, Catherine, sign up for that notification. I cannot prioritize you. I don't have the authority to do that. I'm not allowed to direct anything beyond the state prioritization. But if you're 65 years of age or older, if you have an underlying health condition, you do qualify. We want you to sign up. And if you would reach out to us, we'll be happy to link you up with at least the availability that exists. There's no way to schedule you. I can't do that. But what I can do is at least remind you what the contact information is and give you what information we have. Catherine, when we're done, I'm going to send you that link on Facebook message and make sure you have it. So you at least can have that contact information. I'll send it to you. I apologize. We try to get to as many questions as we can. I think we're one of the few that does this. I mean, we get to as many questions as we can. If you're following us on Facebook Live, we're going to shut down in a moment. Dr. Wythian, I have exhausted our 90 minutes. Anything you want to add before we say goodnight? What generally should folks know about the vaccine and about taking it?
I would encourage people to be informed. Use trusted sites and reputable experts, and consult with your physician in making a medical decision. But again, I would strongly advise people to get the vaccine when it becomes available. And we are asking for patience because, again, this will be a long process.
It will be. 600. We expect that we'll see more doses. Federal government has said they're going to distribute more to the states. We hope the state creates a system that's a little bit better than the one we have, or a lot better than the one we have. We're prepared. I mean, Dutchess County and health departments across the state are prepared to provide assistance. I used this reference. A colleague of mine I thought was really good. It's like a sports game. We're in the first quarter, and we are down by a lot. And so we keep saying the state, put in your best players, and your best players are the public health departments. We are charged with creating these plans. We're supposed to have the structure to be able to administer those shots. And I can tell you, having been to our points of distribution quite often, I would put our volunteers and our staff and our team up against anyone. They're just remarkable. And they're doing a wonderful job for the few doses we're able to give. We can do thousands more a week when we have those doses, and we will. And so please, we need you to hang in there. We understand the stress. We understand the anxiety. Believe me, I understand the frustration. We receive thousands upon thousands of calls and emails a week. We try to get to as many as we can. But at this point, this is the system the state has established for vaccine distribution. We're going to keep at it. If you have any questions that we didn't get to, feel free to continue to reach out to us. We're going to be live again next Wednesday at 3 p.m. we'll be live with a telephone town hall again at the end of the month, February, last Wednesday of February. In the meantime, though, do reach out. Visit us at duchessny.gov. We cannot take appointments at this office or over the phone. We cannot take appointments at the health department. We're not permitted to do that, but we can at least provide you with information we have. In the meantime, stay safe, keep healthy, and please, please, please be kind to each other. Thank you.